Hey everybody, welcome to Mind Matters, Navigating Head Injuries and Concussions, where we dive deep into important topics in personal injury law. I'm your host, Kylie Como. I'm the firm's treatment coordinator and registered nurse. And today we have special guest attorney John Mobley, who's going to be discussing traumatic brain injuries in the context of car crashes and some of the long-term impacts that brain injury victims may experience. John, welcome.
Thank you, Kylie. I just want to start by saying thanks for having me. And, it's a pleasure to be here. We wanted to spend some time today addressing just a few of the scarier long-term effects of brain injuries that the studies show occur after an initial injury.
I guess let's jump in. Let's start with the basics. Tell us what exactly is a traumatic brain injury, or TBI as it's often called, and how common is it in a car accident?
Sure. A traumatic brain injury, or TBI, is a disruption in the normal function of the brain caused by an external force, such as a blow or a jolt to the head. Car accidents and falls are some of the leading causes of TBIs due to the high impact forces involved.
So what are some of the immediate and longer term effects that somebody might experience after having a car accident?
Yeah, immediately after the injury, victims may experience symptoms like loss of consciousness, confusion, memory loss. Long-term effects can actually include seizures, cognitive problems, sleep disorders, and even personality changes.
Let's talk about some complications. We're talking about the brain. It's a fragile organ, right? And so there's going to be a lot of complications, I would imagine, if you have an injury to that. So let's go there. Tell me what kind of neurological complications, might develop, initially after that injury.
Sure. So TBIs can range from mild concussions to severe injuries like contusions, diffuse axonal injuries, and hematomas. Each type affects the brain differently, and it can lead to, various complications. For example, concussion is often a temporary injury to brain function, but severe injuries like diffuse axonal injuries can cause widespread brain damage, leading to long-term impairments.
Yeah, I don't think people, kind of going back to how fragile the brain really is, you talk about that axonal injury. You think about the brain floating in that fluid cavity. When you have that sudden stop from a car impact, that brain wants to keep going, right? And all those axons just get kind of sheared and torn. And, it's like when you cut an electrical cord, there's no signal going to go across that, right?
That's exactly right.
You can have that sudden onset injury, but then there are a lot more kind of delayed onset injuries that might occur, right? So let's talk about some of that.
Great, yeah. And there are several delayed neurological complications that can arise after a TBI. And that's kind of where we wanted to focus a lot of our efforts here today, is addressing some of these injuries. The first one, and one of the bigger ones, is seizures and epilepsy. So when we're talking about seizures, what are we talking about? Focal seizures. These can originate from a specific part of the brain and can cause symptoms like jerking movements in one part of the body or sensory disturbances. Sometimes the person may remain conscious during these seizures, which is a scary thing. Another type of seizure, Kyla, that we see is generalized seizures. These affect the entire brain and can often cause a loss of consciousness. The most common type is the tonic-clonic seizure, characterized by convulsions and muscle stiffness. And I'll just add, we have clients sometimes that come to us that have epilepsy already. Or have a history of seizures. And what we may see after a bad accident or brain injury is an increase in frequency of those seizures, where they might have their seizures completely under control. They've been seeing a doctor, they're taking their appropriate medications, living a good, healthy lifestyle that helps people with this affliction manage it. Then they get into the accident, all of a sudden it goes haywire. Tons of seizures. So just another thing that we see a lot in practice. In terms of the seizure diagnosis process, and one thing is eyewitness accounts. We look at it, or what's looked at is the detailed descriptions from bystanders about what the person did during the seizure. And these can be crucial for diagnosis. Another method is the blood test. These check for metabolic abnormalities that could trigger seizures. There's also imaging studies like MRIs or CT scans, which can help identify structural issues in the brain. Another method is the electroencephalogram, also known as an EEG. This test actually records the electrical activity of the brain, and it identifies abnormal patterns. So a really cool test.
It is. Yeah, I've actually been a part of a lot of those very testings with some of my previous work as a bedside clinician. It's important, I think, for our clients to know that this is a battery of tests. It can take forever to get through all these things, but it's important that they go through each step to help identify, what maybe a part of it may be something they were dealing with before but didn't know. So yeah, I think that's an important thing you bring up, was just kind of some of the different sorts of tests they go through.
That's so true, Kylie. And that's one thing we tell our clients is it's a long process.
Yeah.
That's a lot of tests. And there's a lot of things and a lot of doctors. It can take months, many months, or even a year plus to basically get these proper diagnoses, because you think you have to go for back-to-back tests. They do reviews, follow-up appointments. It's a long process and it's a hard process, and it helps to have, we've talked about this in prior podcasts, but it's good to have a good support structure, someone that can help you make all these appointments, especially when you're suffering from something so severe as seizures and epilepsy. So, one thing we see with post-traumatic seizures and epilepsy, and that's just a different type, is, immediate seizures. So post-trauma, what does that mean? For the folks watching at home, that's like, after a fall or a bad car crash. That immediate seizure might actually occur, and it occurs within minutes to hours after the injury. We have definitely seen that in practice where someone sustains a, phenomenal blow, maybe airbag deployment, hits their head either on the airbag or the window or the back of a headrest, and it causes them to convulse and go into a seizure shortly after the accident. Another thing is early seizures. This can occur within the first week post-injury. And then late seizures, these occur more than a week after the injury. If these seizures continue to recur, the actual term is called post-traumatic epilepsy, PTE.
You mentioned earlier, I'll just touch upon again, the eyewitness accounts are so important. So having that support structure in place, because oftentimes, especially once you're discharged from the hospital, you have the seizure out at home or wherever you are. Somebody needs to see that, because you're not likely going to recall any of that. You talk about an EEG that measures that brainwave activity. It doesn't find a seizure unless you're having a seizure. So when you go to the hospital, you get hooked up to the EEG. Unless you're having a seizure, it doesn't show any activity. So that eyewitness account is so important to talk about what kind of seizure it was, how long it lasted, what did it look like for the physician, because if they can't capture that with an EEG, they're going to need that kind of information to make a better diagnosis. So again, thank you for that very important information.
Absolutely. And that's why we just add that, because more information can help the clinician diagnose better.
Absolutely.
Assess the tier, the grade, how intense it was, and make appropriate recommendations. As far as treatment goes for the seizures, Kylie, so we see stuff with like anti-epileptic drugs, AEDs, medications like phenytoin, and some other ones that can help prevent, reduce, and manage these seizures so that it can improve the quality of life and the affliction that the victim is dealing with, because it's a big deal, right? I mean, it can impact your ability to drive, to have a license. You can lose your license. That's why we always take these traumatic brain injuries very seriously, because some of the after effects, like seizures, can be just incredibly detrimental and have such a huge impact on people's lives. I'll just kind of end that area of long-term effects just by mentioning monitoring. And that really is, regular follow-ups and adjustments to medications, which are necessary to manage the condition. These are serious drugs, serious treatments, and it really requires fine-tuning based on each person. And that goes back to what I said about lots of follow-ups to figure this out. It's a long-term process, because you may have to have multiple follow-ups to gauge the milligrams of your drugs, to see what works. The side effects could be pretty rough. These are important things, just to have a good treating doctor or neurologist that you trust, that is very communicative with you, and so you can get the best outcomes.
Very important. Yeah, I've seen so many patients that are on these types of medications, abruptly stop them for one reason or another. Not knowing exactly what those meds are for, and knowing the side effects of stopping something abruptly like that. So having that trusted physician to be able to teach you how to wean off of that medication rather than abruptly stopping, because stop a medication like that, like you said, it's a heavy hitter and it could cause more problems than you had to begin with. So yeah, absolutely right.
Another area of a long-term injury that can occur post-traumatic brain injury would be certain vascular disorders. So that may include things like an arterial dissection. What does that mean? This basically means it occurs when there is a tear in the inner lining of an artery, which allows blood to seep into a artery wall, creating a blockage. Symptoms can include things like severe headaches, neck pain, and sometimes stroke-like symptoms if the blood flow to the brain is affected. Other things are traumatic aneurysms. So what is that? That's a big word. It's an aneurysm is a balloon-like bulge in a blood vessel. Traumatic aneurysms are caused by injury to the vessel wall. What's the big risk there? It's, well, if the aneurysm bursts, it can cause a severe and potentially fatal brain hemorrhage. Serious stuff. And so that's really the big issue. And that's obviously more the severe types of long-term brain injury stuff, but it's definitely something that you want to keep an eye on. Some of the symptoms of a aneurysm may include things like severe headache, nausea, vision changes, and or up to loss of consciousness. You know, the research says it's usually like, you'll know the type of headache it is. It's one of the worst headaches of your entire life. Yeah, a once in a lifetime headache. That's exactly right. Mm-hmm. So you'll know. It's good not to ignore that and just get checked out. Another thing is a carotid cavernous sinus fistula. That is a very long medical term. This is an abnormal connection between an artery and the vein in the brain, leading to increased blood flow and pressure. So you may notice this if you have, bulging in the eyes, vision problems, headaches again, whooshing sounds in the ear. And that whooshing is actually blood traveling in a very high pressurized thing. Yeah. And it's a very unique sound, and it's something you should keep a lookout for. Treatment often involves surgical or radiological intervention to correct this abnormal connection. Yeah,
it's such an important point to make. I think those are very serious, extreme conditions, but treatments for those have come such a long way. Especially if you've got an unruptured aneurysm, usually you can go in within same day, have those things fixed, little coils put in or clips put on those, little monitoring. You may be home the next day if you catch it in time. So regular doctor appointments, doing all the diagnostics like you mentioned. So important to catch and detect situations like that. So thank you, John.
Another long-term complication, Kylie, is something called hydrocephalus. What is hydrocephalus? So really it's a medical term for water on the brain. And this occurs when cerebrospinal fluid builds up in the ventricles, increasing pressure. So causes can result from bleeding in the brain or blockage or CSF pathways due to injury. Symptoms include, just like some of the previous ones, headache, nausea, vomiting, balance issues, and changes in mental state. Treatments for this would include things like shunt surgery, where a tube is inserted to drain excess fluid from the brain to another part of the body, and maybe even an endoscopic procedure where a new pathway is created for the fluid to flow to.
Yeah, you got to think about the brain, the skull rather, it's a finite space, right? There's only so much. So when you have an increase in that fluid-filled space in the center of the brain, the ventricles you call it, you're going to have less room for that brain to occupy, and it's going to put more and more pressure on that brain, compressing that brain tissue. And as you can imagine, that's not a good thing. So those drains that they put in, you can even do an emergency drain right there in a hospital bed, to where they'll drill through the skull and insert a catheter into that ventricle through the brain and drain that fluid right then and there until they can go in an OR suite and put that permanent shunt in if needed. So very serious conditions and issues, but again, watch for those symptoms. Okay, everybody, that's going to do it for today's episode. Remember to come back for the next one. This is just the first part of a 2-part series. So just remember to hit like and subscribe, hit that bell for all the notifications to stay up to date on our latest and greatest content. And as always, if you're in pain, call Shane at 980-999-9999.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.